right. We're very excited to be welcoming you to our May Health Innovation Community Partnership meeting. Um, as you'll see, we're just ready to get started now. We do ask that everyone please mute your microphone unless speaking, enable your camera, and before we get started, please click on the interpretation button at the bottom of your Zoom menu bar to select your language of choice. Also, please note that this meeting is recorded and will be made available after the meeting on our hicpla.org website. With that, we'll go ahead and get started. We already have covered that. So here's our agenda for the day. We have a lot of fabulous presentations today. I'm excited that we'll be having an update on LAC USC Medical Center. We also are welcoming one of our artists from the community, Star Montana, who's contributed a beautiful work of art to our restorative care village. And we're going to have an interview and conversation with Star. We'll have a transportation update on the I-710 Mobility Hub. Then we'll be talking about local and targeted hire at the restorative care village. We're going to have 3 of the operators from that site joining us today. We'll have, and then finally, we'll conclude with the General Hospital West Campus Development Project update. As we get started, I want to wish everyone on the call and in your networks and families beyond a very happy Mother's Day this weekend and next week. May has so many wonderful things to celebrate in it, but most importantly, I think for many of us, it's really a time to reflect on love of family and love of mothers and the role that mothers and mother figures play in all of our lives. So wishing you and your loved ones a very, very happy Mother's Day. We also want to make mention of the fact that May is Mental Health Awareness Month, and connecting people to resources at this important time of year is critical. As we know, many people in our communities and our families are suffering. The pandemic has certainly exacerbated a lot of concerns around mental health and wellness. So we ask you not to, not to be shy, not to suffer in silence, but if you or a loved one needs help, this is a wonderful time to reach out. If you'd like to share your support for Mental Health Awareness Month, please consider wearing a green ribbon to represent. If you need resources or to be connected to other resources or support systems for Mental Health Awareness Month, we encourage you to visit the NAMI, NAMI.org website. Or, of course, you may always call the Wellness Center and speak to one of our navigators who can help direct you and connect you to services. If there are any other suggestions for places people might reach out for services and support, I ask anyone with an idea or recommendation to please add that to our chat so we can create a rich dialogue and set of resources for people to connect them to services at this critical time. Finally, we're really excited that the Third and Dangler Affordable Rental Homes project is really it's picking up a lot of steam. There's so much happening in the area right now, and today we are introducing a naming opportunity and asking for your support. The project is expected to be completed towards the end of 2023, but we have a survey today to see what your recommendations might be for naming the project and the pocket park that's adjacent to the project. So there is a SurveyMonkey survey. We're inviting everyone on the call to take that survey today. My colleague Juliana will put that link in the chat. So please feel free to click on that and complete the survey and submit your recommendations for naming of the Third and Dangler project and Pocket Park. With that, I'm going to go ahead and conclude this kind of opening portion of our meeting by reading our guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. All right. Well, thank you, everyone, for helping me kick off our May meeting. With that, I'm very excited to welcome Edgar Solis, the Chief Operating Officer of our Medical Center, to give us an update on the campus activities. Edgar.
Good morning and buenos días, and yes, happy Mother's Day and Feliz Dia de las Madres for everyone, all the mothers on listening on the call. So I'd like to start with a couple of updates here at the LACU Medical Center. A lot of exciting stuff happening, but we'll start with the blood drive. There's still a blood shortage throughout the nation, and it's really affecting us here in Southern California as well. This has been exacerbated by the pandemic, where the blood banks and drives have seen a decrease in participation and donation of blood product. So we've partnered with our area blood banks, and here at the medical center, we'll be hosting a blood drive. The dates are posted up on your screen, and you can register if you'd like to donate. If you're able to donate, we welcome you to help us out and provide that donation of blood. That's very critical for our patients that come through our ER, and also that have some of these surgeries that will require some blood transfusions. Um, and secondly, our COVID clinic is still operational. We have decreased our hours of business because we're trying to match the hours of operation to the demand, but we're still available to open both to the community and our staff members. For those that haven't received vaccination or are looking for a booster shot or the second booster shot for those eligible, we are open every Wednesday and Friday from 10 a.m. to 5 p.m. And we're located in the same area in our General Hospital auditorium. So you can make an appointment, or you can just walk in. We'll be glad to help you out and provide that vaccination. This month in May is Asian American and Pacific Islander Month, and we will be celebrating the great contributions that our AAI PI staff members contribute every day to our medical center. We will be, anyone can submit if there's anyone that you think should be recognized. There is an online form, or you can email to that email you see on your screen, that anyone that you feel deserves some recognition, or you would want to recognize some of the work and heroic work that our Asian American Pacific Islander staff do. You can go ahead and submit that, and we will be highlighting a different staff member every week. And next week is Hospital and Nurses Week. So National Hospital and Nurses Week is an awesome event that happens every May, where we have fun events for our staff members and our nurses to recognize all the efforts that they've contributed throughout the past year. This week we have a lot of fun events happening on throughout the week. From Crazy Socks Day, which is my personal favorite. You get to wear your funky crazy socks. And also another favorite is Retro Day, where our nurses come dressed in costume of some of the nursing attire that has been used throughout the history of the nursing profession. So we have a lot of fun events happening on those days, raffles, giveaways, and of course food. So everybody loves food. I know I do. And so that's happening. Hospital Week is happening next week. And we invite you, if you'd like to come and say hello. We'll be available outside in the courtyard outside of LACUSC Medical Center. And our EDIA committee will be hosting listening sessions where our workforce can come and voice their opinions and to shape how we move forward in developing our EDIA initiatives. Those listening sessions will happen from May 23rd to June 3rd, where we invite our workforce to again voice their opinions and what they feel we should be working on, or some of the barriers that they see in our initiatives as we move forward to ensuring we have an equitable and inclusive medical center. And I'd like to give a quick update. I know there's some questions regarding the COVID-19. So here in the hospital, we're doing really well with COVID-19. We went for about maybe 4 weeks without admitting a patient that required medical services for COVID-19. Now, because we still continue to test everyone that's admitted to the hospital, we will see some positive results in some of the patients. But that doesn't necessarily mean that they're here for COVID disease. In other words, they may be here for a surgery, or they may be here for problems with their heart. And so when we test them, they do turn out positive, but they're not exhibiting symptoms, or they're not here because of COVID disease. So that's a very positive for our medical center. We range about 8 to 12 COVID positive patients in the medical center. But again, we continue to ask that our community follow the guidelines, and we continue to ask that our community continue with their vaccinations when they're eligible, because we're now moving into the endemic phase of the pandemic. And there's still community transmission. If you follow the LA County Department of Public Health daily updates, you still see that there are still positive cases. I think yesterday was 3,000 positive cases. But here in the hospital, I guess they're not sick enough to need medical services in our facility. So that's doing really well. Our staff, we're still holding strong with our staff. Our staffing levels are adequate. Our PPE in form of masks and all the equipment that our staff need to remain safe, we have at appropriate levels to continue providing those services on a daily basis. So we're doing really well in terms of COVID, but we still want to be vigilant. There's still community transmission. And so we continue to abide by the guidelines and continue to offer vaccinations.
Thank you so much, Edgar. Really appreciate it. So we do have a question for you. Vivian's asking if the booster also includes J&J.
I'm not, what we offer here at LAC USC is the Pfizer vaccine, and the Pfizer vaccine has been approved, and I believe the Moderna has been approved for that second booster. As if you recall, there's two boosters now: the initial booster and then the second booster. The second booster has different criteria. I believe you have to be 50 years old or older, or have some medical conditions that make you eligible for that second booster. But here at the medical center, we offer the Pfizer boosters.
Yes, thank you. Yeah, so I think that definitely for us, I think and then I think my understanding is that you can mix and match. Is that correct, Edgar, to the best of your knowledge? So if you started with the J&J, you could now get a Pfizer booster, and sometimes that might even be recommended.
That's correct. It is allowed to mix and match. The latest CDC guidance was there is allowance to mix and match. So if your original vaccine series was Pfizer, you're allowed to get Moderna, or vice versa. I believe there's been some new recommendations regarding the J&J vaccine, and I'm not too familiar yet, but we can bring that back next week when we talk to our Chief Medical Officer, Dr. Brad Spelker.
Yes, thank you. I noticed something that just came across my headlines yesterday too about J&J. So anyway, but yes, to reiterate, of course, we do Pfizer here at the medical center. So if anyone is looking for a Pfizer shot or a booster, that's what we can do for them. Okay, next up, AAPI Healthcare Heroes. Obviously fantastic to celebrate our AAPI colleagues. And then just to ask are the events that are happening here for National Hospital and Nurses Week, are those open to the public or only to the community of the medical center?
It's geared towards the medical, our workforce, and our nurses and our healthcare heroes. But if you happen to be in the neighborhood and you want to see what's going on, you're more than welcome to come in and check out some of the events that we're having in our courtyard. I believe our public information officer, I don't know if we've confirmed yet, but we will have a food available for purchase. So that's something that's available as well. But yeah, this is something that we've been working on for our staff to just celebrate them for all their efforts that they've done in the past week. And if you come by, you might see me in I'm also a nurse, and so you might see me in my retro costume of some of the uniforms that we used to wear.
I can't wait to see some photographs of that, Edgar. That sounds like fun. But yeah, I definitely wanted to mention that Supervisor Solis will be with us on Thursday, and there will be a memorial service in the courtyard recognizing those lost to COVID. So I know that that's something if people want to join us for that, please do. And then you can see that there's a lot of other exciting opportunities and events. I know there's some entertainment. And like you say, there's a real celebration of the legacy of healthcare on our campus, the nurses, and their incredible work here. Let's see, final question. Just another question too about the EDIA, which is our Equity, Diversity, Inclusion, and Anti-Racism initiative across all of the DHS campuses. Is this survey exclusively for employees of the medical center? It sounded like it might be.
It is, but if we welcome your feedback as well from the community. If there's something that you want to, as a patient that you've noticed, or as a patient perspective that through receiving services here that you feel that we need to know about, and you would like to voice that to us, we welcome that input as well.
Okay, thank you so much, Edgar. Do we have any additional questions for Edgar? All right, I guess not. You covered it all, Edgar. Thank you so much for joining us today.
Thank you, everyone. Have a good week.
Okay, so I'm excited. Next up, this is the first of our civic arts conversations. We hope to have several of these to celebrate the incredible artists that are bringing their beautiful works of art to our campus. We are really grateful to Iris Rain from the LA County Department of Arts and Culture, who helped facilitate this incredible opportunity. And we welcome the artist Star Montana to share with us her vision for the work that she's created for our campus. So Iris, if you'd like to introduce us, and I'll stop sharing my screen so Star can share hers. Iris?
Everybody, it's nice to see everybody again. I am thrilled to introduce this series, especially with Star. I was thinking this morning about how wonderful and intense and meaningful the collaboration has been, and all the help from the community in developing these projects, and how proud I am of these artists, which Star is obviously one of our stars, in completing really major artworks for the community. And I was thinking about what is the role of artists? Why do we love art? Why is it meaningful to us? And I just wanted to say, and this is completely personal, so this isn't the arts department speaking, that I think one thing that makes Star's work so meaningful is that she trusts us with a very, very intimate view of her world. And in this act of sharing in beauty and trust, our world enlarges, and also that it sort of ties us together in this sort of common humanity, so that we go from something very personal that becomes really universal and brings us all together in community. Anyway, those are my morning over coffee thoughts about the work of Star Montana, who is someone that I respect and admire so much. So I'm going to leave it to you, Star, I'm going to leave the floor to you.
Thank you very much, Iris. I really appreciate that. Okay, let me share my screen. Let me share, I'll just share this. Okay, so, okay. So this is the work, and this is directly what the mural will look, what it looks like. So let me give you this view of it. So yeah, so this is called East Los Angeles landscape. And so this is a landscape that I took in 2015. This is a landscape that I took in City Terrace. And so kind of what Iris is referring to. So this is a landscape, but it's a little bit more complicated than that. I took it in City Terrace. It's overlooking City Terrace, East Los Angeles, Boyle Heights, and it goes um all the way to downtown. There's even like kind of like an Easter egg, like not necessarily in the mural, but you can even see the USC Medical Center right here to the right. In the original picture, you can kind of see it. And in here, it's a little bit harder. So I had been trying, when I talk about this image, and so this is a part of a series that I worked in as well, a long-term series of artwork that I've been working with. And like my back picture is a part of it too. It's called By the River, I stand, I stand and stare into the sun. And so that title is from like a quote in the Bible, or it's also it's from a book, but then it's also from the Bible. It's from when the Israelites had been exiled out of Babylon. It's by the river Zion. I I wept for Zion, and so that's kind of what the reference was. But it's also a book that by the river Bierta, I sat and wept. So that's what the book I had read, and it's kind of being when you're in exile and you just want to return home. So that's kind of when I was doing art school in New York, and I was really wanted to come back home to Los Angeles, but a lot of people said it would be better if I stayed in New York, because New York was better, or you make it, but I really wanted to return home to East Los Angeles. And I remember I was just like, I really want to come back to home, and I was thinking about these works, and um, I I returned back at the ending of Christmas, like December 2014, like so 2015. And so then I made this work in winter 2015. But I had been trying to make this portrait or this landscape for about, I always say about 3 to 5 years. And so I used different types of cameras. I used the digital camera, and when I used the digital camera, not all the detail would come out. I would lose like to downtown, and like it just wouldn't all that, like not all the detail. And so I'll show you the original picture. Let me see. Um, and then when I use a 35mm, oh, of course, let me see. When I use the 35mm camera, again, not all the images would come out. So it took me years and like crafting it and thinking about it, like what would be the right way to come up with this image. So I had to think and think and really reflect on it. And then it would be the season. So I might come back in summer, but it would be too bright to take this picture. So I would come, and I wouldn't be in Los Angeles, so I could come in summer, and then it would be too bright. So I might just get this part of it, but then the downtown area would be gone. So if you see, oops, right there is the medical center. And so finally, when I had returned home, I had my medium format, so it's a larger negative. And it was winter and it was overcasty. And I finally was able to accomplish this, this image. there was just a day of meditation with me and my friend. And so this is a place where he actually likes to go draw as well. So we go to these kind of high up places and we meditate artistically. Like he'll go and he'll draw for about like 2 hours. And then while he's drawing, I go and do these landscapes. And so I take my time. And so while he was drawing, I was taking this landscape and I was taking some detail shots. And so I remember when I photographed it, I was like, I think I have something. I think this is it. Like, I'm finally able to capture something that I've been thinking about for a really, really long time. And so when I finally developed it, because it was film, something felt different. It was like, this is the image I had been thinking about for a really, really long time. And so it became part of my series. And now that it's part of the mural, so I'll go back to the mural. Oh, excuse me, sorry. Right here, you know, it does look different, but it also is able to be, you know, the conversation. So it's cropped a little bit differently. Like there's not as much white, but I feel like, you know, it's something that I want to be a part of my work, but I feel like there is a universalness to it. Like when I have conversations with people, they're like, oh, I think that's from El Sereno, or, you know, they kind of have their thoughts of where is this taken at? Like I know exactly where it's taken, but people kind of tell me where they think it's located because there's this kind of universal feeling of their area of Los Angeles, you know, or how they feel, or what's their idea of, you know, what is the person who took it, what they were thinking at that moment. And I really like that idea, you know, I like that idea that there's open interpretation in this image, you know, because for me, if there's something that I want to put into my work, but I also love leaving it open to interpretation and that you can kind of reflect on it and think about it and that there's a peacefulness to it. You know, it's not hectic. You know, you can kind of think about it and think about what's going on in the picture, and there's not a lot of chaos. And I think especially with the restorative care village and the people that are in the restorative care village that need a lot of time to heal, that I think it's the perfect image in that way, that they can just kind of look and think about like life and just meditate, and you know, it won't be triggering in that way. And you know, with Iris's help, we were able to make sure there was nothing that would trigger you know, any of the clients or anything like that. So yeah, I want to make sure. Oops. Is there any questions? I could keep talking about the work. I don't know how I am for time.
Thanks, Star. You're doing great. I think we have about 5 minutes for questions. Does anyone have some questions for Star about her process, her vision? And then, Star, I don't know if you were part of the community feedback process where you had
Both.
community members speak
Mhm.
and give reflection. You might speak a little bit about that experience and kind of what you heard from community.
Yeah. Oh, and thank you for whoever put the Psalm 137. Yeah. I appreciate that. Yeah, so the feedback, there was you know, there was really good feedback in that, you know, how community members felt about it. You know, that was the feedback of like trying to figure out where it is and, you know, what they felt about it. Like, because so far, you know, I mean, people have seen it like when they see the art, but the community feedback was, you know, kind of guessing where it is or where they think it is, you know, in that way, you know, and what it reminds them of, and or like where they grew up at, you know, because I mean, you know, you people are familiar with the area and how it's hilly in that way, you know, like there's the little bit of flat land and then the hill part, you know, so I think for a lot of people, like they're like, oh yeah, it kind of reminds me, is it over there? Is it over, you know, or like referencing little areas, you know, it could possibly be El Sereno, but then I'm like, oh, it's City Terrace. They're like, oh yeah, of course, you know, in that way. But I think most people think like El Sereno or stuff like that, you know?
You know, I love that there's this kind of common sense of the community, and everyone can see themselves and their experience in this beautiful picture.
Mm.
Ari has a question. Ari has her hand raised.
Mhm.
Yeah. So what I note from the piece is that it's sort of like an instantly recognizable Los Angeles landscape. But then when you look a little closer, it's not the Hollywood. It's not the landscape that is presented worldwide from a Hollywood movie perspective. And so I think it helps to educate in terms of the fact that there are different perspectives for Los Angeles and different life experiences. And that, you know, that's what I like about it. I appreciate what you're saying in terms of the peacefulness of it. But I think there's also struggle in there in
Mhm.
terms of, you know, the houses that you're seeing from that perspective.
Yeah,
But
totally.
thank
I
you so much
mean,
for your
yeah, no, I totally agree. I mean, it's an empty lot where we're photographing from. So like, you know, that's a lot that used to be a home. So I totally agree what you're saying. Yeah. Thank you for that.
Yeah, an unusual, iconic Los Angeles landscape. That's truly what it
Mhm.
is. It's not the Beverly Hills palm tree lined avenues that we've seen in a million, you know, movies and other scenes. This is that shot of the East Side staring at downtown, and it really just you captured it on such a beautiful day too, Star. That overcast really creates that kind of dreamy quality to it. You
Mhm.
have other questions or comments for Star?
No, thank you for
We
sharing.
have a couple we have a couple comments we have a couple comments for you in the chat that I'll read
Yeah.
aloud, Star. Carla Gonzalez says, Star, this art is so very special. Thank you for pouring yourself into this beautiful piece.
Mhm.
And we have a comment from David saying it looks great from a USC perspective. We also engaged with local partners to combine community youth and artists. Here's a link on a mural we developed in partnership with Weingart East LA YMCA. So he's commenting on other arts movements in the area. And we have a comment from Juana. Está muy bello porque me conecta con mi hogar y mi comunidad. Gracias.
It's very beautiful because it connects me with my home and my community.
Yes, thank you.
Yeah, listening.
And we have a link in the chat to your website, Star, so people can enjoy more of your beautiful work.
Mhm.
Well, I think certainly New York's loss is Los Angeles's gain. We're so happy you decided to return home, and just really delighted that you were invited to participate in this project, and you've gifted our campus with such a beautiful work of art that really represents the community, which is what we were hoping to achieve. So thank
Yeah.
you, Iris. Thank you, Star.
Yeah. Thank you.
Okay, well, with that, we will conclude our first civic arts conversation. As mentioned, we hope to bring forward other artists in the future so HICP can really hear about the process, the perspectives, and what goes into creating these civic works of art that are gracing our campus. With that, I'm delighted to move ahead in our agenda. We next up have a presentation on the I-710 mobility hubs given to us today by Ryan Johnson. Ryan, take it away.
Hey, good morning, everyone. Can you hear me fine?
Just fine.
Excellent. Yeah, and I love the art setup. So that inspired me this morning. So thank you, Star. That's beautiful. And it's a pretty good segue because as we'll get to in a little bit, we're gonna talk about types of placemaking opportunities, and that will include some
Sorry, Ryan. Somehow I think you got muted. We were trying to mute someone who was making extra.
Okay.
But I think we muted you by mistake.
Yes, I apologize for that.
It's
Sorry.
okay.
Quick fingers. Thanks, Ryan.
Okay, I was just rambling anyway, so it was good to get cut off. like at the Oscars. Yeah, great. Good morning, everyone. Thanks again for having me. And I'll remember to slow down so the translation can happen. But yeah, I wanted to again thank the artist, and that was a good setup because we're going to talk a little bit more about placemaking opportunities in the area around the LA County USC Medical Center. But also it's a larger study area, and we'll get to that in a second. Next slide, please. So here's the agenda, and just a quick introduction. I'm a transportation planner at a firm called Alta Planning and Design, but we are working directly for Southern California Association of Governments, SCAG, but also the City of Los Angeles, Cal State LA, Alhambra, and South Pasadena. So yeah, we are the consultant working on the Mobility Hub study here. So today we're going to talk a little bit about the definition of how we're considering a mobility hub, what it means. We'll get into the project background and the funding and the vision goals. I'll talk a little bit about who's in the steering. And then we'll look into the analysis and how we came up with the top 10 potential mobility hub locations. And then I'll share some current outreach that's happening around the area. Next, please. Right. So yeah, this is sort of a trendy term in the urban planning field these days, mobility hub. But there are some examples out there that help illustrate what we're talking about. The image on the bottom is at Union Station, actually serving bus lines that do travel to the medical center and the east side, Northeast LA and the San Gabriel Valley. So what we're generally talking about is a place where different modes of transportation come together seamlessly, and it can take different forms, different sizes. But here at Union Station, obviously a major transport hub, we wanted to bring together bus, rail transit, as well as bike share technology. And then if it's hard to see in the distance, but there are screens that show when the buses are arriving, so providing that information, and wayfinding signage, things like that as well. And then you can see the native landscaping, which is an element we're trying to encourage more in new transit stations and developments. Next, please. These are some of the potential amenities that we are considering. As you can see on the bottom, we have the mural there as an example. So kind of tying back to what Star was presenting on, we are looking for opportunities to just beautify the areas around our city as much as possible whenever we are going in and touching a space for some kind of transportation improvement. But we're also looking for opportunities to create just public space where people can enjoy getting out, being with each other, enjoying shade, which is going to become more and more important, just places where we can rest and enjoy a cool environment. Next, please. We decided to create these 3 typologies for mobility hubs, since not every location will be the same context or size. So it could be as small as a bus stop that's being improved, and maybe adding things like bike parking or scooter share, and then moving all the way up to a larger hub, which would be more appropriate to a campus like the medical center campus or Cal State LA. And in between there is a rail station, like a Gold Line station or a Metrolink station is what you could picture there. Next, please. I'll get into what each of these might look like. So kind of, again, looking at the amenities that might be possible at a bus stop. Since it is a smaller footprint, we'd be trying to squeeze in things like seating, parking, signage, and then again, the shade and shelter. Next, we'll look at the rail station hub. What it could include anything in the previous slide, but then since we do have a little more space, looking at more capital intensive improvements and maybe long-term bike parking or car share parking, electric vehicle charging stations, things like that. Next. And finally, the larger campus hub, which again, this would be more appropriate on the medical center campus and on the edges, adding things like convenience stores so people can buy something on their way home or before they hop on the bus or on the train. But also the workstation idea there at the bottom with Wi-Fi capability. As we've all learned the last couple of years, we can be more flexible in how we work. And especially at the Cal State LA campus, a lot of students there are interested in workspaces outside or maybe at their bus stop while they're waiting. And I could see the same thing being applicable around the medical center campus. All right, and getting into the background of this specific study a little bit. So you're all aware of the 710 project, I'm sure, and how that drama played out. But if not, quick background and reminder. So Metro withdrew its planned freeway extension in the northern end of the 710 freeway. So a lot of that money is being repurposed to surface street transportation improvements. And if you go to the next slide, I'll continue talking a little bit more about the other projects. So I want to make sure that we're not confusing you and mixing this up with the street projects that are happening. So the city of Los Angeles is studying bus and other street improvements for Valley Boulevard, Huntington Drive, and Eastern Avenue, which are all very relevant to where you all are. And so those are going to be more focused on moving people through the area and to jobs. What our study is focused on are more static points and those connection points. So if people are transferring from the bus on Valley, for instance, and getting onto an electric scooter to go further into the medical center campus, that's kind of the facilitation that we're tasked with here. I didn't have a slide, but I also want to remind you all about the San Gabriel Valley transit study that's ongoing with San Gabriel Valley COG, the Council of Governments. So they're looking at rapid bus improvements throughout the San Gabriel Valley, including some that would be in this area. So we are coordinating with all of these projects. Go ahead, next slide, please. I'm not expecting you all to read all this text, but you can check it out later when you get the slide copies. But yeah, we do have a set of goals that we're focused on. And our vision is pretty simply just to make getting around and accessing jobs and important destinations seamless, safe, and frankly more fun and enjoyable. The next, please. All right, getting a little bit into the study area. It's kind of a strange geography, but we're kind of bounded by the freeways over here, but also trying to find the nexus between the 710 freeway gap and how we can get people to the major job centers. Next, please. So these maps are in a little more detail. I'll go through a few of these, but we did some existing conditions analysis to help us identify potential hub locations that would be highest priority. So we looked at population density here. A lot of these won't be a surprise and they'll overlap. Next, please. The employment density, obviously the medical campus is a huge one, Cal State LA. But a lot of the travel in this area, frankly, is going towards downtown to where most of the jobs are. So we understand that as well. Next. So we also mapped the transit ridership. So the circles here that overlap quite a bit, they're showing bus boardings. So it's the number of people getting on at these specific intersections. So it obviously overlaps a lot with the job density. So you can see there are several bus stops around the medical campus that are high ridership. So it was hard for us to pick just one or two sites to focus on. But the intent of this project is to create a model and a template moving forward so we can apply that to other locations in the future. So when we get into the next few maps, be thinking about if you have any feedback on the locations we chose, and we can possibly adjust those. But you can go to the next slide. I think this is the last one of these kind of maps. We did look at existing and proposed bikeways, such as protected bike lanes or bike routes. And we don't, I'm not showing it today, but we are also considering where sidewalk gaps are, making pedestrian improvements. Obviously with the rail line on the north side of your campus, that is a barrier for people walking into campus. So we're talking with the city, to see what they're considering as far as the Valley Boulevard improvements, with possible overhead bridges and things like that to make pedestrian access better. Next, please. And then we created a composite map to, this sort of lumps in a lot of criteria that looked at equity considerations and demographics, and the darker blue census tracts here, or the census block groups, they're showing where the highest need is based on this these definitions. And again, yeah, the area to the southwest of the study area is pretty high need, but also in the center part here in El Sereno neighborhood. And then Cal State LA, of course, with a lot of younger students, and particularly students who are more moderate, coming from families with more modest means and income. So we wanted to obviously provide more opportunities for travel there as well. So next, please. All right, so these are the 10 locations that we have narrowed it down to study further. So the first part of the project was going through the analysis and finding these locations that do need improvements. And then moving forward, we're going to actually dive into the details and provide some concept designs and transportation improvement recommendations around them. But as you can see, we tried to spread it out across the study area somewhat, but the three here in the yellow are the ones that are the larger campus mobility hub types. So at Marengo and State, which we could talk about in the Q&A, that's one of the key priority hubs. But then we also have them that spread out at various bus stops and rail transit hubs. Next, please. Oh, great. You were able to slip that in. Thanks, Heather. Yeah, so this is what I mentioned at Marengo and State here. So typical diagram, and we have this for all the 10 locations. But we just sort of mapped out what the amenities are already there. We have revised versions of this that show which specific bus stops come in, so we can get into the details of ridership. But yeah, this is a pretty good example of what we're looking at across the study area, because it shows where parking is, but also bus stops and destinations. So we could look at opportunities in these parking structures or parking lots, or whenever there's future development opportunities. That's the kind of opportunity that we would look for to actually build a mobility hub and make some improvements to facilitate the travel and connections between modes. Next slide. All right, so just an update about community engagement. We are actually in the midst of this round of workshops. So we've already completed 3. We've had great feedback at Cal State LA. We went to the Kite Fest in Ascot Hills, and then we were at the big Open Streets event in Alhambra this past weekend. So we have one more opportunity for folks to come out in person at the South Pass Farmers Market. But we also have our website there at the bottom. I encourage you all to take a look at the web link there and share it out. There's information on the site, and there's a comment form at the bottom. So if anyone has suggestions or questions, they can always submit a comment, and it goes directly to me, to my email. And I can also add you to our sign up list for updates. We don't currently have the survey open anymore. We had a survey earlier in the project, but we will do a 3rd round of outreach that will have some more online interactive elements. So that'll take place in the summer, and I'll get into the timeline on the next slide. So again, we're sort of in the middle. Like I said, in the summer, we'll refine our vision and present the concepts and the drawings to the community to get their input. Next, please. This is sort of another version of that. So again, we're right in the middle. So it's great to come to you all now, and hopefully it's not too late for you to get involved. But we definitely want the medical center and all of the stakeholders, everyone on this call, to be engaged and included in our process. Next, please. All right, so there's my information. But like I said, the general comment form on the website does go directly to me, but you can also just email that email address directly. So yeah, I'll take any questions, and I welcome feedback or criticism. So go for it.
Great. Thank you so much, Ryan. Really appreciate the presentation. I'm going to return to the hub locations that we're discussing right now, and then of course this visual of the Marengo and State Street corner of our campus. We have a few questions for you in the chat. I think Teresa's hand went up first. Teresa.
Hi, good morning, Ryan. I attended that street event on Sunday, and it was really nice that we had that opportunity to, verbalize the needs. I am an employee at LAC USC, and the lighting has improved when it comes to that bridge area, which is great. But again, the unhoused are still there. So as you move forward, just keep that in mind. And can you, maybe I missed it, can you verify if the stop is going to happen, the metro stop going to happen at our facility?
I believe you're referring to an additional
train.
MetroLink station
Correct.
that they've been proposing. I can't speak to that. Yeah, I wouldn't want to speak for MetroLink, but
Okay.
I have heard of that. I know it's being considered, and I'm a big supporter of it. I ride MetroLink myself, and but that's something. If it does move forward, we'd obviously would love to be involved in the development of that station and making sure there are connections to other modes. And I took your note about the situation at the rail crossings and the unhoused situation there. So yeah, we're looking at transportation improvements, but we always do keep in mind how that would affect people who are living, in-house or on the street. So we don't want to be a burden. I mean, they're residents too, and often use the transportation system. So we need to consider that as well.
Great, and I'll save my that question for Metro. But thank you for your time.
Yes, thanks.
All right, we have a couple other questions, hands raised, and we have a question in the chat, but we'll go to Ben.
Hi, Ryan. Ben Feldman here. I'm with Supervisor Solis's office. And I appreciate the presentation. I just thought it would be helpful if you also gave a little bit of background about the coordination between your efforts and the various other 710 efforts. I know that there's a lot of other, cooks in the kitchen, so it'd be helpful to know that there's coordination there. Thank you.
Yeah, good point. And yeah, as I mentioned earlier, we are coordinating very closely with LA DOT and other City of LA staff on those projects on Valley, Huntington, and Eastern. So they've been presenting to our steering committee. We've been presenting back to them. So there's coordination on the projects. For instance, at Valley and Mariondale, which is that hub location on the north side of Cal State LA. So with the Valley Boulevard project, they are considering some rapid bus improvements. So we are prioritizing that stop as a potential hub location where students could get on and off the bus, but also maybe grab a bike or a scooter and get onto campus, which is a pretty long walk and very hilly, as you all know. So yeah, that coordination's happening for sure. And I'm glad, Ben, that you were on, because we've been wanting to get more engaged with Supervisor Solis's office. So I'll probably follow up with you directly. Just that we obviously want you to review any concept plans we come up with in the next few months.
That'd be great. And I think I sent you my email separately. So
Okay.
We should be good to go. But thank you again. This is great.
All right, I did see a chat. Oh, go ahead.
Oh yeah, we'll have Ari and David, and then we're going to pivot to the question Vivian left in the chat. Thanks, Ryan.
So my question is, you invited criticism, so I'll try to meet that challenge. Well, on my way to work, there's this bus bench that somebody had to build themselves. It was actually an article about that published a few years ago. So my point is that, you know, there's the infrastructure for bus ridership and public transit is weak at this point. And so the maps that you're showing is those that have overcome whatever barriers there are to usership. And so therefore, if it was improved, maybe there would be more usership. And so it sounds like you're improving the spots that people have been successful using, but not addressing the spots that could be successful if they were enhanced. So I'm a little concerned about that. And then secondly is, so now that you have this information, how can the dash bus, the shuttle bus, the medical center's shuttle bus be routed now? You know, what are we waiting for in order to enhance those services? What is your timing on your project, and what will be be implemented?
Great. Yeah, thanks for the hard pitches there. Yeah, you know, I agree with the first comment about the bus stops. Obviously, as a rider myself, it's very frustrating when you're sitting in the sun with no shade and no bench. So that is a bigger issue. I mean, for our study and our scope of work, we had needed to focus on, you know, where you get the most impact for limited dollars, and those were the higher ridership stops where there are already a lot of people riding. So, you know, at Huntington and in the center of El Sereno, there are a lot of riders transferring. But in between there are bus stops that are terrible, frankly. So what we're doing, and part of our aim, like I mentioned earlier, was to create a model and a template moving forward. I mean, the county and SCAG, they're not planning to just improve 10 transfer locations around the entire county. They want to do this county-wide. So we're trying to come up with a model that can be replicated, essentially. And so what we're going to do in the next phase of study is come up with concept designs that are feasible. We'll price them out. We'll include, you know, the estimates of the different amenities and elements. So hopefully those other stops, you know, as the city gets more money, they'll have a template they can apply. So yeah, the point of this is to make that easier and spread it city and county-wide. To your second question about Dash and the shuttles. So yeah, we also have on our steering committee representatives from Metro and LADOT who work on the Dash program. And so we've already had some discussions, and I believe Heather and Anna are aware of those conversations with Wayne at Metro about rerouting some Metro buses, but also I know Dash is a key player. So that's kind of happening behind the scenes. I don't work at Metro, so I don't want to speak for them too much. But I think Wayne was interested in presenting at some point to this group. And then you all, and I've invited Heather and Anna, and we can share that invitation to some of our future meetings with our steering committee, which is, you know, it's a public forum. So yeah, we'd welcome any suggestions on rerouting those services. For us, we're looking at the hubs and the transfer points. And in this stage, it's just a planning effort. So we don't have money to actually build anything yet. You know, we're prioritizing the projects, getting them ready for grant applications. And at that point, that's when we could actually, you know, move the bus service to those locations. But great criticism. I know that the next gen bus rollout too with Metro, you know, that's been hindered a little bit with the driver shortage for the buses. So I know there's a lot of frustration after all that change. You know, bus service seems to have gone down in many places. That's mostly due to, you know, a lack of drivers, and they're actively working on that. I know, trying to recruit more drivers for the buses.
Thank you. And David has a question for us, and then we'll pivot to the questions in the chat. And
Yes,
we're
Ryan.
kind of in lightning round now, so if we
Oh,
could keep
sorry.
it tight, that'd be awesome.
Yeah,
Thanks so much.
I'll be brief. Ryan, I'm representing USC, just north on Zonal. And as you know, we have tens of thousands of students, community members, faculty, patients on our campus every day. We work very closely with the city and Metro and others, and we've had a number of conversations with Cal State LA. So I think going forward, we'd love to connect you with our transportation folks, because a lot of what you're proposing is very similar to what they're proposing. And we've actually provided the city with some funding that may be to CD14 that may be able to alleviate some portions of this. So we'd love to stay connected and connect you with our folks going forward.
Thank you. And I saw your email in the chat, so I'll follow up with you. Thanks.
All right, then we have a question from Vivian. Has there been a pilot program of ridership between the hours of 1 a.m. to 5 p.m. to see ridership has increased, since many jobs do begin between 3 and 4, such as the Vons, Ralph, for those beginning shifts between 12 a.m. and 4 a.m. So I think that early morning ridership and any assessments of that time period.
We looked at all transit ridership data in our analysis, so we didn't discriminate based on any potential shifts. Now we're looking at 24-hour travel essentially at our hubs. But yeah, thanks for that note, and I'll make sure that we address that in our report specifically. So yeah, good point.
And a final question about security from Juana. I think always a concern in our particular area around our healthcare campus.
Yeah, security is key. I mean, our theory and what's borne out in practice is that, if you have these mobility hubs as public spaces where more people are gathering, that creates more eyes on the street, more safety in numbers, essentially. But technically we would add, obviously have lighting and things like that. I mean, and it's possible that the agency in charge of that jurisdiction could have their own security officers. We're not precluding that in any way. But definitely that comes up in most of our outreach. People bring up security quite a bit and the lighting.
Yes, we've heard that time and again at this table as well. The security, the lighting, the cleanliness. And I was really excited about the amenities you described. I'd love to hear more about, the potential amenities that are being considered for our particular campus. But I think in the interest of time for the rest of our presentations, we'll say thank you so much, Ryan, for joining us today. And we look forward to learning more in future presentations. Just to reiterate for everyone, there is an upcoming opportunity to join a community workshop on Thursday, May 12th at the South Pasadena Farmers Market. Alternatively, please visit the 710 Mobility Hub's website. And of course, you can be in touch with Ryan. So
thank you so much for having me.
Thank you for joining us today. Okay, so view full screen mode. All right, so right now, if my computer will cooperate, I hope I haven't overwhelmed it with too many requests. We're going to move to our next presentation, which is a really wonderful update on, our, hang on, I'm so sorry. Give me just one quick second here. Having like I say, some technical challenges. Nope, that's not the right one. Anyway, I will ask Rosa to go ahead and kick us off while I get the presentation ready to be shared. Rosa.
Thanks, Heather. And what a lot of you don't know is that sometimes our speakers and partners, are coming down to the wire because I'm sure they're just as busy as everyone else. So just appreciating Heather and the team behind the scenes who might be updating the master PowerPoint while presentations are going on. So thank you, team, for the great work. So Rosa Soto with the Health Innovation Community Partnership and LAC USC Medical Center Foundation. I'm really, really proud of the work of the subcommittee for local target hire. And today they'll be presenting particularly around the restorative care village. There are new operators that have been approved by the Board of Supervisors and will soon be launching as part of the opening of the restorative care village. So we want to hear from them. But before we do, I want to acknowledge Isidro, who is here with us to ensure that he gives us a quick update on the committee and on the and on next steps regarding our local target hire. So Isidro Villanueva from WEDAX, are you here?
Yes, good morning. Thank you, Rosa. Thank you, Heather. And yes, I apologize because I know I'm one of those last minute speakers and trying to get a presentation together. So if I may, I'll share a screen or a slide just really quick to go over. And hopefully I do this right. And let me know if you're able to see it.
Yep, there it is.
Great, thank you. So good morning. My name is Isidro Villanueva, currently with the county's Workforce Development, Aging and Community Services Department. Although I will update everybody, and maybe hopefully everybody knows that come July 1st, the department will be splitting into two separate departments. I will be joining our department that will focus on workforce and economic development. And then we're getting a second department that will focus on aging and community services. So stay tuned because July 1st, you'll hear about two new departments that the department is adopting or implementing starting July 1st. So again, good morning, buenos dias, happy Friday, and Feliz Dia de las Madres. Again, my name is Isidro Villanueva. I'm here to talk about our work around our subcommittee, our sub work group on focusing on local and our local hire efforts. So as you know, there's a lot of work, construction work taking place at LEC USC. With that, because these are county projects, and I think Alicia Ramos is here with the Department of Public Works, the county has a local and targeted worker hire policy where according to the county policy, 30% of those hours worked on those projects need to go to local residents. And local residents, or the local hire definition is individuals that live within a 5-mile radius. And then also there's a second tier, which is individuals that live with what we call qualifying zip codes, and is based on levels of income countywide. Right, so the goal is always trying to achieve that local hire goals or number of 30% with individuals from the 5-mile radius. However, through work here, kind of led by Rosa and Heather and the partners here in the Health Innovation Community Partnership, they've pushed the county and and thank you to the supervisor's office of trying to achieve an aspiration goal of 50%. So not just looking at 30%, but can we do a little bit better and trying to achieve a 50% aspirational goal. And also with an emphasis of looking at a 2-mile radius of, within the project from the campus of LECUC to try to really target closer to home, if you will, residents that we can move on to these projects. So I want to give you a quick update again on kind of where the projects stand. And again, Alicia Ramos, please feel free to chime in on kind of, if I misspeak here. But here you'll see that on the Wilmington Children's Hospital, a 50% local hire effort was achieved. So that's good because that's what we want to see. And so I think the work there has pretty much been completed at least to the phase where we've gotten the reporting. So again, they've achieved a 53% or a little over 53%. And then you'll see that on some of the ongoing projects, they're above the mandatory county requirement of 30%, but there's still some work to be done on trying to achieve that aspirational 50% goal. Again, now, like I said, when we meet during the subgroup or the subcommittee meetings, we go into further detail as to how these goals are actually reached. Like I mentioned, there's different ways that a contractor or these projects can achieve those goals. So then we look at, again, how many individuals within the 2-mile radius, how many individuals from the 5-mile radius, and then how many individuals, again, countywide that qualify as a local worker actually make up these numbers. So again, I won't go into details here, but I do encourage those that have any questions or want to know more to join the meetings, which take place the last Friday of every month. We meet and kind of go over these numbers and again have a discussion as to, again, how are we doing or what our plans are on achieving these goals. And again, even if we are achieving them, how is it that we're truly achieving them by looking at, further into the data of, again, trying to identify individuals with a 2-mile radius. We've also incorporated the project over at 30 and Dangler, and that is a project led by our LA Community Authority and Development Department. So it's just kind of also getting started. So you'll see here where that project currently stands. But again, some work to be done there and trying to achieve not only the county the requirement of 30%, but then also trying to reach the 50%. Now, again, the committee has been focusing on kind of the construction projects, but obviously we know there's a need for further workforce development and trying to identify further job opportunities for our community here within the LAC USC campus. So what I will say that though, through this project, what has happened is now that our East LA Occupational Center has what we call there's a construction specific training program. It's called the multi-craft core curriculum that is sponsored by the different unions that are located here in the county. So again, we've tried to create a pipeline and identify that we needed to create a pipeline for these construction jobs. And so now there's a training that people can enroll to actually enter union construction jobs. And although they might not land specifically on these projects, at least now there's an access point where they can get training and get help with getting sponsored into a union apprenticeship. So that's some of the work that's happened through this committee. And also now we're looking at some other peripheral job opportunities through the LAC-USC campus. So I've also talked about entry level position or an entryway into our county jobs at the actual medical facilities at LAC-USC through our Department of Health Services, who's looking for certified nursing attendants and medical assistants. So again, we'll be looking at the East LA Occupational Center to kind of help us develop a pipeline or identify individuals for those positions. But then also there is now that these facilities are being built, there's also opportunity within these facilities. And so now you'll hear about some of those opportunities for some of the providers that will be having those job opportunities. So the goal is to work with them to identify, again, local residents and prepare them for those job opportunities. So I'll turn it over to Rosa to introduce those providers, but thank you. Oh, and if I can, I will share this slide with Heather, and you'll see that also, and I want to give credit to Modern Times because it created a dashboard for us. And I don't know if I'm still sharing my screen, if you can see the dashboard. And I'll share it in the chat as well. So because this is open to the public and it just kind of gives updates of what the committee is doing. It gives updates on each project. So again, we want to kind of route everybody to really look at this dashboard, and so that any information regarding the subcommittee or job opportunities will be posted here. But I'll share it in the chat. But again, I want to give thanks to Modern Times for helping bring this dashboard to life.
Thank you so much, Isidro. And yes, we also want to make sure there's a direct link from the HICP main page to the subcommittee, because we know this is a very important subject in our community benefits planning for the committee. So thank you so much, Isidro. Next, we have Dr. Josh Banerjee, part of our clinical team here at LAC-USC, and he's actually joined by his partner, Dr. Carla Gonzalez, who's also offering a lot of support these days to the Wellness Center as our Wellness Center Liaison Medical Director. So thank you both for being here. And so Dr. Josh Banerjee is going to talk to us about the Restorative Care Village and the opening of the 5 buildings that have just been completed. So I know we yet have to do a grand opening, and we don't have a date for that yet. So we don't know when it opens, but there is a lot of work in the background, as I mentioned, because of the contracts being executed. There's at least an opportunity for the providers to start connecting with each other. So thank you, Dr. Banerjee, for being here and teeing us up on how important this part of the campus is to LAC-USC.
Yeah, good morning, everyone. I couldn't be more thrilled to join you all, and could not be more excited or hopeful about the opening of the Restorative Care Village. Just from our perspective as providers at this medical center, this is a game changer, right? I mean, the opening of the Restorative Care Village is really going to be a game changer for us. You see on the slides in front of you, it's going to offer 96 recuperative care beds and 64 crisis residential treatment beds. which are going to just so impactfully fill, you know, a place in the continuum that is so needed for our patients, right? So we, you know, hospitals provide acute care, inpatient management with, you know, 24/7 nursing, monitoring, you know, physician support, until a patient is stable enough to not require that level of intensity. But there's often they need more than just, you know, they might not need inpatient treatment, but they're not going to be able to thrive or fully recover independently without, you know, stable recuperation in a safe and stable setting where they can receive medications and other services that you would otherwise be able to provide at home. And so the opening is just by the numbers is going to be so huge for us. But there are other two parts that are really exciting about these, you know, this particular model in the restorative care village. First is that it's just so lovingly, thoughtfully designed. You know, we spend a lot of, actually it's our core driving principle to be as patient and community centered as possible. And this has been so thoughtfully and lovingly designed. And, you know, I don't know if Star's on still, Iris, you know, I had the privilege of actually seeing Star's work in person, and you know, I think Carla would agree, we were captivated. You know, captivated. I mean, this is you know, when we think about what our patients see and what they will be seeing as they recover here, it's inspiring, right? And then the final piece, right? So the numbers of beds, how this the village has been designed, like the thought and love that went into it. And then finally, its proximity to LAUSD. It is on our campus. This is what we're incredibly excited about, which is that, you know, over the last year, we've already been building connections with, you know, with the teams that are going to be running these sites. And so in addition to their, you know, their obviously expert staff on, you know, caring for patients in this setting, they have us for support. So if there's any questions about, you know, if, you know, patients' cases can be dynamic, if anything develops where they feel like they need medical consultation, they have a call to us rather than just, you know, many times centers, their only recourse is to send the patient back to the ER, but that's not good for the patient in front of us or the patient not in front of us, right? We want to do the most gentle, you know, right care, right time, right place. And so, yeah, I just couldn't be more thrilled to be a part of it and to work with Carl and the rest of our transitions of care team on providing support for our wonderful partners in the restorative care village.
Thank you so much, Josh. And I just wanted to make note, we sent one of our team members to take some hot off the presses photos just earlier this week. So as Josh was saying, please enjoy some of these outdoor visuals about our fabulous new facility and all the wonderful services you just described, Josh. Also, just to tee up, we are planning a larger, more full update, hopefully at our June meeting to kind of dig in a little deeper and have additional presentations on the restorative care village. So with that, I think we're ready to turn to the restorative care village portion, or pardon me, it's all restorative care village, but the operator portion of the presentation, where some of our operators are going to talk about their local and targeted hire, the local and targeted hire workforce opportunities.
So do we have someone from JWCH? Should we start with them?
Yes, my understanding is someone from JWCH was going to try to join us. They do have a staff retreat today, so we were a little limited in who was available, but is someone from JWCH on with us today?
That's okay. If you're there and are having technical difficulties, let us know in the chat and we'll come back to you. Let's go on to the next.
Yeah, let's move on. I'm delighted to welcome Mariela from the Telecare to give us an overview of the Telecare Magnolia House. Mariela, welcome.
Sorry, I was trying to unmute. Hola a todos. Thank you. Welcome. Feliz Dia de las Madres. Happy Mother's Day. We are absolutely thrilled to be partnering with you all. This is a very exciting time for Telecare to be part of this amazing project to help our communities come together. And yes, so our one of the homes that we'll have on the campus is called Telecare Magnolia House. Thank you. And so overall in Telecare, just to tell folks a little bit, if you haven't heard about Telecare, we're a pretty large organization. We have about 151 programs across 5 states in 36 counties and currently 42 customers. So far, since 2021, we've served over 26,355 clients that we refer to as our members. And we currently, actually that number is probably a little lower now. We currently are close to 5,000 Telecare employees. Thanks. So what we're really super excited about joining this mission with you all is that Telecare Magnolia House will be on the campus of USC. We will have the CRT there. It's a 16-bed short-term intensive residential program. And we're really working on basically, like what Josh reiterated, it just provides a recovery-oriented intensive supportive services to clients over 18 years of age or older. And our mission is to ensure that it's a safe and therapeutic home-like environment. And once you get to actually come in, and I invite you all to come in and take a look once everything is ready, you'll get to see the setting is really a very home-like environment. That is the vision that we try to provide in all of our Telecare programs. Our mission and our goals is to help the therapeutic environment decrease any type of distress, psychiatric distress that our clients, our members are having. And really the overall goal here is to avoid inpatient hospitalizations, to decrease the utilization of emergency services and incarceration so that people can really regain their stability and live their hopes and dreams within our program in a safe environment. We're going to work on ensuring that we establish linkages with stable housing, ensuring that they have continued treatment once they actually graduate or leave our CRT program. And the average length of stay, as we've been discussing and kind of coming to a decision in terms of that with the CRTs, is about 10 or 14 days. Now, depending on the licensure category, typically folks don't stay longer than 30 days, but there's always that exception, and we're willing to work around that to ensure that everybody's getting their needs met within the program. Thank you. And what we are going to be providing in terms of our crisis services, these include, but are not necessarily limited to, brief solution-focused therapy, trauma-informed care, motivational interviewing, cognitive behavioral therapy, dialectical behavioral therapy. Absolutely, we will be having clinicians, psychiatrists, and nurse practitioners on site. We'll be doing assessments, treatments, brief stabilization, medication evaluation and support, work the process along with our clients and their families on the discharge planning evaluation, ensure that we are wrapping our members with all types of services so the continuum of care can be something that is successful for them once they transition from our CRTs. So the wellness and recovery action planning. Within 72 hours, our goal at the Magnolia House for Telecare is that we will be engaging family members in a supportive and active care. The families will be encouraged to attend family therapy sessions on site. And again, the big mission, of course, is that we want to ensure all of our clients, our members, have linkage to our communities so that they're ready for that next step in their level of care, whether that might be a lower level of care or it might be an ERS or a step down level of care. But our goal is to ensure that they're gaining the skill sets to be able to actually transition once they're ready. Thank you. And the admission criteria is really anybody in experiencing a behavioral health crisis in Los Angeles County. Again, our services are provided to folks that are 18 years or older. And we are 24/7 staffed. We are going to be having 3 shifts 24/7, as we stated, Monday through Sunday. These are the 3 shifts that are listed here on the slide, as well as the on-call rotating shifts will be available on a daily basis.
And I
Thank
think
you,
that's
Heather.
it, Mariala. Um, so I think we're also joined by Shalonda Williams. Shalonda, are your tech issues resolved?
Can you hear me?
Yes, there we go.
Awesome. Good morning. My name is Shalonda Williams. I will be the director of the Recuperative Care Center on the campus. We will have 96 beds, about 80, 90 staff, going from physician assistants, nurses, case managers, CNA, medical assistants, down to housekeeping. We are currently trying to recruit local hires as I speak.
Excellent. Shalonda, how can people be in touch? Is there something we can add to the chat for people to connect with the hiring process?
Yes, I will put my email in right now.
Fantastic. Appreciate that. What kind of numbers are you looking at in terms of hiring versus kind of redirecting existing staff? So we have Shalonda joining us from JWCH Institute. As mentioned, they are going to be the operator for the largest single facility on the Restorative Care Village, which is our Recuperative Care Center. Very exciting. Do we have a representative from Star Clinic? I think they also were potentially joining us today.
Yes, good morning. I'm Steve Albrecht, filling in for Kent Dunlap, the CEO. I'm the regional administrator for the greater LA area. And first off, I was going to say that I couldn't help but think about Star's comment as she talked about this whole process of developing the work that she created in the 3 to 5 years, from the vision and the creativity and the tenacity and the endurance that she had to develop what she did. And I think about the CRTs being just that as well. This is the crisis residential programs. This is something that has been under development for years and part of a bigger picture of meeting those middle grounds needed for behavioral health services. STARS Behavioral Health Group has been in California since 1988, and we have annually serve about 30,000 children and families. We're in 10 different counties and have about 45 different locations. We're in, and actually for the company, I've been with the company for about 13 years. I developed the first crisis residential program in San Bernardino County on one of their campuses 8 years ago. Our motto is partnering with people for positive change. And so we're very excited about being in the community. We will be actually operating 9 of the 16 DMH built buildings between the Downey sites, Olive View, MLK, and here. So we're very, very excited about that. In addition to the, an additional piece of information that's going to be really useful for about these CRTs is that they're actually going to be used as step down facilities as well, from psychiatric hospitals being able to step down for someone that doesn't need the level of acute care of a psychiatric facility, but frankly, in today's environment, with a CRT not existing, they stay there. And so this will help immensely with the freeing up of psychiatric beds for adults in our community, as well as this will be a great step down from our behavioral health urgent care centers. Currently, our organization has one in City of Industry and Lancaster and Long Beach, as well as those others that Exodus has. And this will be an opportunity to step people down from their acute crises into a longer term, albeit 2, 3, 4 week length of stay, but to stabilize the progresses that have made and truly changed the trajectory on people's lives. I'm very excited about that. Locally, we'll be recruiting for administrators, a program manager that will oversee the program or program director, clinical supervisor, because there's both a day-to-day operating function there, as well as a clinical overlay. Psychiatrists, nurse practitioners, a peer mentor, because the peer relationship in these kinds of environments is so important, and recovery counselors as well, resource specialists, because we'll be referring people in, we'll be referring people out, because people are going to be coming in with such varied needs, and we need to be very connected with the community. So we'll be recruiting anywhere from 25 to 30 people per CRT, so 50 to 60 people, multicultural, multilingual. Basically, one of the things that we pride ourselves on as an organization is hiring people who represent the clients and families that we serve. And so we will have our positions actually, although there's an entire process with getting credentialed and licensed and all of that will still take another couple of months, I imagine. We have our all of our positions by Monday will be posted on our website, which I'll put in the chat with a link to how to get to us. And I'm very excited about being here.
Great. Thank you so much, Steve. Steve, Shalonda, and Mariela. I think Ben had a comment he wanted to share. Ben? Ben, you're muted if you're speaking. Oh no. Well, while we wait for Ben, we did have a couple questions in the chat. Josh, I'm going to kind of direct them to you, and you can maybe help us field them across the team. The first is from Vivian asking about particular services for our unhoused neighbors to give them a respite moment to then recuperate and kind of be positioned for a better return to community.
Yeah, so I'm going to try to go to the chat. So the question is, are unsheltered or unhoused neighbors and community members able to benefit from the? And
yeah, I think if there's specific services for them in this complex, because it was directed at Magnolia House, but I'm not sure if it's for Magnolia House or for one of the other houses. But just, I guess, with this new facility, what specific services are really targeted to the unhoused?
So I would say it's actually a question for both of us. I mean, I think on site I'll defer to our partners on how they would assist, but we are also, there are linkages to us that we have a very engaged, fiercely committed and robust social work team here, and we have partnerships with Housing for Health and street medicine teams, connection with the street medicine teams. So I think yeah, both in terms of our partners and in, again, that dialogue and communication with us, we have I think a robust and committed framework for assisting our unhoused, unsheltered.
Thank you, Josh. Mariela or Steve, what response would you have related to specific services or kind of the opportunity for unhoused individuals to benefit from the residential treatment program?
Certainly. When we opened up our first behavioral health urgent care center in Long Beach, statistically, we predicted that about 10 to 12% of our people that came in a mental health crisis would be homeless. It turned out to be 25 to 30% of the people that came in for mental health crises were homeless. So part of the working on short-term and longer-term housing is one of the things that we address. Being homeless can actually precipitate a mental health crisis for people. My experience with our CRTs in San Bernardino was that about 40% of our youth came in homeless. And so that is, part of the step down element of this is being able to really meet the person where they are and look at the crisis that they're experiencing and focus on that. And so working on people's homelessness with people who come in due to mental health issues, then that would be something that we'd work on. All of our referrals are going to be coming in through a centralized service with Department of Mental Health. And so they will be the screeners that will move them to us to basically work with the problems that are presented to us at the time. And homelessness certainly is one of them.
Mariella, anything to add?
I think Steve said it perfectly. We are centralized with Department of Mental Health, ICD, Intensive Care Division, and our goal is absolutely to serve those that are unsheltered and all the needs specifically. We'll probably get, I know, a lot of referrals directly from LACUSC and through our communities, and we're very excited to serve them. Currently, we are doing that in our outpatient programs as well as in our inpatient programs, our urgent care centers. And so we're going to continue those efforts to collaborate for those that are needing housing, additional support and treatment. So Steve, you said it perfectly. Thank you.
Thank you both for your response. We also had another question from Vivian, and I think I'll say this is the last question, and then we'll end with Isidro, and then I think if Ben is able to join us. But a little bit about the services for the local population, and just wondering if there's any kind of preferential kind of enrollment into services on this campus for people that are from the community. I don't know who might be in the best shoes to answer that question in terms of referral pipelines or preferential location to this campus.
Oh, are we talking about radius location, or are we talking about?
I think radius location, geographic, within the kind of couple miles of the radius. If there is that model with the DMH, you said as the centralized system through DMH, kind of how do we refer, to kind of try to keep people more closely connected to their community, and of course with the family-based services, making it more accessible for family members to engage.
Absolutely. And I would also probably ask for Josh's advice on here, but typically since we are centralized through Department of Mental Health, ICD, Intensive Care Division, that's all of LA County. And so we get referrals from all over the county. And so we're welcoming everybody that lives within, could be within 2 miles, it could be 30, 40, 50 miles, as long as they're an LA County individual coming in. Oftentimes what we've had folks that are transitioning even from San Bernardino County and transitioning to LA County to be closer to families, family integration. And so we work closely with the county on that as well and supporting those individuals. But our main focus is, of course, to ensure that the area within our surrounding communities are provided the services that they need. So hopefully, if that answers that question. Or...
Yeah, and I would add, just I think in terms of the fact that the co-location with LACUSC, and then just the size of LACUSC in this community, we're the largest medical center in the Department of Health Services system. Level 1 trauma center. We're really, really big, and in our catchment, I mean, we can provide numbers, maybe at a follow-up meeting, but I mean, we really do serve our local community. So just by the math, by the numbers, we're going to be serving our local community and providing these, again, just really exciting, effective transitions through the continuum.
Thank you, Josh. We have definitely said, Steve, did you want to add in?
I was also going to add that the county was very intentional in very strategic in looking at trying to disperse these sites geographically in Sylmar, in Downey, in LACUSC, in MLK, very, very intentional about this. And also given the fact that there is a centralized hub and network, in theory, the goal would be to get people treatment closest to home, but the network exists. And so if someone was in need of treatment, my vision would be that if someone were in need of treatment and a location was at capacity and there's capacity in another, then that would be used as an overflow kind of environment. So that was just the addition I would make.
Thank you so much, Steve. So we've had a really robust conversation. I know we have a lot more interest in these topics. So I think we'll ask Isidro for comment, then Ben, And just to remind everyone, we will be having a deeper dive on this subject at our June meeting. So if we are unable to get to your questions today, or if you're still formulating your questions, please be sure to bring them back to June. Isidro.
Yeah, no, just really quick, and thank you for the information, Mariela, Steve, and Shalanda. But I'll be reaching out. Again, we want to be, I think, a little better coordinated and be more intentional with the work you're doing around recruitment, as you see in the questions and the comments in the chat. So we are here to assist with that, and again, to make sure that, you know, as many as possible of the job opportunities that are available go to the local residents. But with that, knowing also that there's, you know, some coordination and planning that needs to take place. So we're here to assist. So I'll be reaching out so that we can help achieve kind of those goals and the goals of the committee here. So thank you.
Great. Thank you, Isidro. Ben, final comment. Guadalupe, final comment.
Apologies. There's something odd that's happening. I think I show up as Ben, but it's me, Guadalupe.
Yeah, sorry, Guadalupe. I kept calling for Ben because I thought that's who was texting me.
Apologies, everyone. Technology, you know, sometimes it has its kinks. But no, I just wanted to share that for today. I know this is just you know, a very general introduction to the providers that we wanted to provide to the membership here. And we're really excited that, you know, the providers for the recuperative care beds, that's JWCH, and then for the crisis residential treatment beds, you heard from Star and from Telecare as well, who have joined us. There's going to be 4 providers for the crisis residential beds, and then 1 provider for the recuperative care beds. And so today was an introduction. We're very excited about the permanent job opportunities that these facilities will be bringing. We have connected with them along with our partner Isidro, who has been leading our local hiring subcommittee, where a couple of you are part of our you know, participants. So we're going to be actually you know, coming back in June with a more detailed presentation about the local hire opportunities and job opportunities, the permanent ones for all of these facilities, and with, you know, numbers, the different types of jobs. So more details on that. Again, we have had a good engagement in regards to the construction related jobs, but we are teeing up to position ourselves for the permanent jobs for the local community. And again, you know, we have met with some of the providers and they're very much aware about the community's, you know, desire to go beyond a 30% and shoot for an aspirational 50% on the, and so we're going to follow up on that. I just wanted to share with you. And in general, the recuperative care beds are more medical oriented, right? For folks that are coming out of having medical treatment or surgery, and they need a place where they can recover because they don't have a home, right? And for the crisis residential beds, it's psych oriented, right? And it's not medical, it's psych. And so that's the distinction between the 2 sets of facilities we will have on campus. And so we're really, again, looking forward to more services to our local communities and job opportunities. So with that, I turn it back to Heather.
Great. Thank you so much, Guadalupe. We always appreciate the leadership from your team to really hold center space with us about really elevating the needs of the community and making sure that all of our projects and priorities are responsive. That is really the purpose and goal of the Health Innovation Community Partnership. And it's so exciting to see this fantastic project come to fruition. With that, I thank so much Shalonda, Mariela, Steve, Isidro, Josh for joining us and presenting these highlights of the Restorative Care Village. We know we'll be seeing much more of you in the future, and we'll be hearing more as we go forward. It's just a very, very exciting project, and I know we're all delighted to see this come to actual life and fruition. And of course, really an opportunity for our community residents to receive services, but also to engage as part of our campus community as a potential employee. So thank you so much, everyone. With that, we're going to move to our final presentation of the day. We have obviously run a little bit over time. As often happens here, you guys are really engaged. You love asking a lot of questions. And so we take a little extra time on some of our presentations. We do have some very exciting announcements with the General Hospital Feasibility Study, which I'm delighted to share with you all today. But there is much more to come on the General Hospital and West Campus Development Project. So this is once again just one of many additional future presentations we'll be making on this subject. But let me make this announcement first and foremost. After 3 years, the feasibility study was submitted to the Board of Supervisors on Friday, April 29th, 1 week ago today. And it is available on the HICPLA.org website for everyone's review. The study is a thorough review of the threefold county conditions, the technical considerations, and of course the community input that has been such an invaluable and central point of the entire study. So we'll go through some highlights of the study in just a minute, but just wanted to reflect that the website has the study available for you to read or download. So please check it out. We also have an opportunity for people to leave feedback, to leave a comment card. An online comment card on the study is available on the website as well. Oh, and just one thing to mention, the study was produced in English, but we at HICP will be translating the summary portion of the study into Spanish and posting that on the website as well. So stay tuned for a Spanish language version of the summary report. So here's some highlights of the study. First, let's take a look at the table of contents. Kelly Quinn has joined us from CEO's office. This is, the labor of love of her team and the entire project team. It comes in at about 600 pages strong across both the main report and the appendix. So there's a lot to review in this document. But you'll see in the main report, there's the introduction and key findings. There's the origins of the study, which include the motion and Supervisor Solis's vision for the campus and the Healthy Village. Then the study looks at the process itself, particularly focusing on the community engagement process, how they developed county requirements and looked at the technical considerations. Then there's a rich report on the community engagement findings, as well as the existing conditions and improvements analysis, some market analysis, affordable housing analysis, finally dovetailing into a reuse framework and illustrating some of the potential funding sources. That's in the main report. The appendix includes a wealth of rich materials that informed all of the report findings, including a great wealth of detail around the community outreach and engagement, historical analysis, improvements that are under consideration, and that market research and affordable housing analysis. So you'll see here kind of a summary of the reuse framework. In particular, looking at the community voice and where community has elevated their priorities and their needs for this campus to really fulfill its greatest purpose of being a community serving hub and space located on the LAC USC Medical Center that improves the quality of life for patients, for community members, and for the surrounding areas. The priorities are listed here in alphabetical order, but just to highlight some of the key ones that were brought forward. Really an incredible interest and need in affordable housing, including deeply and extremely low income and for families. Ideas about after-school science, technology, engineering, and arts mathematics center for youth. Ensuring that we continue to enrich our campus with arts and cultural spaces, as well as commemorative spaces that really reflect the history and create a community here on our campus. We want, of course, to emphasize community services, health and social supports, ideas for a library, as well as really emphasizing locally based retail, and of course, the neighborhood grocery store that is the fond wish of many, many people in the community. Looking at open spaces, obviously considering the needs for parking and other services that might include a preschool, daycare, a senior center, or the low-cost extended stay hotel for families visiting patients at the medical center campus. And of course, always a reflection on workforce and economic development opportunities, ensuring that there is indeed, like Guadalupe was saying, there are the county requirements, but there's always our aspirational goals which exceed those to ensure we create opportunity for our local community. As we look at the county requirements, we'll ensure that General Hospital meets all the applicable building codes required for the facility. That's an incredibly important opportunity and cost center to be sure that we improve our general hospital and make it accessible and useful for future purposes. Of course, our beloved LAC-USC Medical Center, the jewel in the crown of public health care in the County of Los Angeles, we want to continue to accelerate the great work of this campus and ensure its future as an innovator and as cutting-edge medical care, best-in-class care for a world-class community. We want to, of course, reflect on the different policies that will pertain to the campus and making sure that we can, once again, continue to retain those core functions that are required of our healthcare campus. Technical considerations. Well, I think you've heard it at this table many a time that these are very complex areas and sites that are being considered for redevelopment. And there's a wealth of concerns and considerations that need to be taken into account as we move into future development phases. Once again, the study's goal really was to bring in all of these ideas and considerations together to land in the center space of a reuse framework that will inform the RFP process and ultimately be the foundational element of how developers can develop their proposals that they will submit to be considered for a role in the in the campus, in the General Hospital and West Campus development. So this is a balancing act of those community inputs and needs, the technical considerations, and the county requirements that we just mentioned in summary. Here's a little bit more of a reflection on a few of the community inputs that were discovered through the process. In particular, we kind of laid them out in 3 different slides, one around community stressors, in particular looking at those incredible challenges that the community faces and how do we leverage those challenges that the community is feeling to really make a campus development that will serve and ameliorate some of those stressors. In particular, looking at COVID, that has magnified a lot of the economic stressors, including closing of small businesses, lack of opportunities for small business owners, and access to safe, clean street vending opportunities. All of those have been really challenging in the community and exacerbated by COVID. We know that there's concerns for environmental justice and pollution that has particularly hit this community hard. There's a lot of food insecurity issues. And then, of course, the gentrification concerns. As we see so much development happening in downtown Los Angeles and the surrounding communities, there's really a need to address that opportunity to maintain some community stability and keep local residents local. We also, have a community that suffers from high unemployment. There's certainly the homelessness concern that's been discussed a lot here, lack of adequate public transportation and access to the broader LA landscape. And then the community engagement opportunities and making sure that we fulfill upon those. Mental health services and limited parking for hospital patients and neighborhood residents. I'm delighted to say that in the context of this HICP meeting, we've touched upon many of those issues because we do hear them time and again that they are really challenges felt deeply by this community. So as we pivot from the stressors, then we look at the priorities expressed during the community engagement process. And here you'll see many of them that we've illustrated before, the need for mental health services, the need for affordable housing, ensuring that there is retail small business support for procurement that really emphasizes local businesses, workforce development, as well as the many other considerations that have been brought forward through the community engagement process. And then, of course, that translates into uses. So we have stressors. In response to stressors, we have the priorities the community has uplifted. And now, of course, we have the uses. How might this campus development really respond to those through specified uses? I covered a lot of these in the first slide, so I'm just going to breeze on past so we can get to some of the updates. County requirements, as mentioned, largely retaining the functionality and ensuring the future of our healthcare campus as a public serving medical center. Technical considerations, as also has been described here many times, Our general hospital, the building behind me in my picture, it has a lot of challenges at this point. Having been opened in 1933, it is severely out of date in many ways and needs extensive remediation to become a functional space for any purposes. And then West Campus, of course, presents its own unique challenges. It has several aging buildings and structures that will need to be demolished and replaced in order to ensure space for future development on the West Campus. So with that, I'm going to pause, or I'll highlight what we're going to cover in the rest of the meeting. At this point, we're about 6 minutes to go. I hope people might be able to stay a little bit longer, as I imagine there will be some questions, and I still want to allow some time for Doug Cohen from WEDAX to do a quick overview of next steps with our RFP process. But just with regard to the study itself, we will be hosting our final community meeting on June 2nd. We are actively creating opportunities for comment on the feasibility study. We have some responses already received. We have a comment card opportunity on our website. We're going to be having comment cards available at Hospital Week next week on our campus. So if you're joining us for those activities, please stop by the Wellness Center booth to leave a comment. And then we will be doing a survey at our community meeting on June 2nd. We're also looking to, like I say, translate the study report into Spanish to post to our website. And then, of course, the entire project is now pivoting to the RFP process. So Community at Large meeting number 5 coming up on June 2nd. You can register for that to receive updates on our HICPLA.org website. And then we have here some feasibility study feedback that we wanted to share out with you. Rosa, would you like to walk us through? And anything that I missed in my lightning fast coverage of the study report highlights. Rosa? Here you are.
So just wanted to acknowledge the incredible efforts of our community partners to participate in these processes. And I know we have so many of you that have participated either in a community at large meeting or in a other process within the Health Innovation Community Partnership that can inform a lot of what the feasibility study now holds and will help inform our future efforts as we move forward in the redevelopment of this beautiful campus. We did receive a letter from Eastside Leads prior to the release of the study. And as you all remember and participated in previous meetings, a lot of questions about what was in the feasibility study, how could the feasibility study address some of the challenges that are being faced. And so we appreciate Eastside Leads for bringing to the forefront of discussion what still needs to happen as we move beyond the feasibility study into the future phases. And so the letter was addressed to Supervisor Solis and this Health Innovation Community Partnership and presented to the co-design committee. So members, if any of you would like to share any thoughts, we appreciate that as well. The letter included an acknowledgement of the strong community engagement that has transpired over the past 5 years, and acknowledged that the process has yielded a strong relationship with community and acknowledging those community priorities. And one that lessens fears of displacement and harm. And that's a really important aspect of the work that we're doing here in the partnership and with each and every one of you. Also, the desire to continue with a strong framework for community benefits and accountability in the general hospital feasibility study and in future phases. So just appreciating Eastside Leads for acknowledging that up front and for appreciating the partnership here with the county partners, with the supervisor's office. In addition, the letter articulated the desire to keep a consistent and transparent community engagement process between our LA County agencies, our General Hospital Reuse Consultants, and the Health Innovation Community Partnership to future phases of development for a general hospital on the West Campus. Setting clear metrics for affordable housing. They uplifted that this needs to meet the need for affordable housing for the lowest income households on the East Side. And I think, as we have heard, there is a clear identification by the feasibility team of the need for services for the lowest income housing. Strengthening existing local and target higher goals. We talked a lot about that in the previous conversation through assessment of current goals and by creating youth and adult workforce opportunities regardless of immigration status. benefits. So yes, we are really thinking of the diversification of that in this, and we appreciate Isidro and the work of the subcommittee that many of you join, so that we can continue to develop those pipelines and have a more robust local and target strategy for everything that we do going forward in development. Also incentivizing affordable rents for retail, small business support, and local procurement, and that being important, as we think about the redevelopment and future opportunities. And then providing low-cost parking and improved access for local transportation. Again, a lot of this, the local transportation hubs, you've seen over the last couple of months be prioritized at the Health Innovation Table. But I think what Eastside Leads was really pointing out is the importance of this to be hand in hand, interconnected, right? As we think about future opportunities for a community to have a voice past the feasibility study phase. And I don't want to, sort of uplift more than that without, some of the Eastside Leads leaders being able to share as well. So I don't know if someone from the Eastside Leads team wants to, give a few further comments regarding, right, your aspirations and your hopes and the desire of this letter's impact.
Thank you, Rosa. And partners, I know we're almost at time, but I mean, you see it here. It's a great summary of our 4-page letter. For those of you that are joining this great HICP space for the first time, my name is Pamela Agustin. I'm an organizer with the Eastside Leads Coalition. We are a coalition based in Boyle Heights, and we bring together 9 nonprofit organizations from the area, youth and parents as well, tenants, property owners as well. So we are very diverse, but we have been part of this partnership since 2017. So we just feel that, like many of you, obviously 62 of you here today, 61, we are very invested in making sure that this capital project really brings about jobs, economic opportunity, and everything that you see listed. We submitted this letter partly because at the time we just feel still a bit uncertain of what will be the role of the partnership and individual residents in guiding the next phase for the request for proposal. But I know that in looking at the feasibility study, a lot of our concerns were incorporated, but we still have that lingering thought, and this is, to all of the partners here, is how will we specifically be engaged in the process, right? For example, partners, today we heard from the 2 organizations that will be hiring for Restorative Care Village permanent jobs. We'd like to be part, right, as partners that have been part since 2017 in guiding permanent jobs for our residents beyond construction. I know it's possible. That's what this letter says, a lot of possibility. We offer ways in which it could happen. Happy to share it in the chat with everyone to read at your own time. But I don't want to take more time, Rosa, other than appreciate that input was taken into account. Of course, we still have some questions, concerns, but we want to make sure that Q&A happens. So I pass it back to you, Rosa.
Thank you so much. And yes, appreciating that this is an identification that more is needed, more dialogue. And I've seen a lot of the department partners be willing to reach back and be at the table here. So thank you everyone for your incredible collective work. We just want to remind everyone there is in the HICP website where you can access the study, there is the comments section there that you can add comments to, and we'll be coalescing those and sharing those back, as Heather mentioned. And there's also a community at large meeting. Heather, do we have a slide on that? Mm-hmm. All right, so community at large meeting will be on June the 2nd from 5 to 7 p.m., also via Zoom. We would like to open up the Wellness Center to have computers available and a larger screen if people want to come and see it in person here with us. And I know a couple of the other partners have offered to do that as well. We'll be posting those opportunities on the HICP website, and we'll send an email reminding everyone of that opportunity. I'm saddened that we still can't have in-person meetings for this work, but we think it's probably the safest approach given, some of these numbers that we're seeing right now. So, we do want to ensure that there is access to in-person for those who haven't been able to join us. So please stay tuned and help us spread the word so people can come and share during that meeting. We've also extended the meeting from 5 to 7 so that we have a bit more time, right, for community discussion. So Kelly, to you, to your team, thank you so very much, not only for leading the effort and this incredible study, but for being a exemplary partner at the table here and always willing to uplift, what can be done in addition through other opportunities at the county. So thank you guys so very much. Back to you, Heather.
You are very welcome. Thanks, Rosa.
Yeah, thanks everyone. So if you have some questions for Kelly, please feel free to throw those in the chat. Otherwise, we'll have additional opportunities in the future. I mean, most of you probably haven't had a chance to review the study yet, but of course, please join us at June 2nd. We'll be doing a nice presentation at that time and have a lot of opportunity for checking in with many people from the study team. So that's a really wonderful opportunity to learn a little bit more about the study. And kind of here's our next speaker, Doug Cohen, who will tell us a little bit about what happens with the study next. So Doug's going to give us some quick updates on the RFP process, which is kind of the subsequent phase of our development project. Doug, welcome.
Hi, everybody. Thank you, Heather. Actually, it's kind of we're typically not at the tail end of these meetings, and it's a very thorough presentation on all facets. So, again, congratulations to the organizing all this engagement. In front of you right now is a timeline for what is essentially the very first phase of the delivery of this project, and that is the RFP. We will be drafting the RFP. There is a process once the RFP is drafted of posting, actually making ourselves available to the developer community during the time at which they are creating their responses. And then they submit their responses. There's an evaluation process that takes place. And what this represents is that period of time between drafting the RFP and us then going back to the Board of Supervisors with the authority to engage in a series of agreements known as an exclusive negotiating agreement. And then one of the key components with respect to the community's input is once the developer is selected is what is known as an outreach plan. And so that's what's in front of you right here on this timeline. What the following slides are going to describe is within this timeline, we're trying to do something that quite frankly is a little bit different. And what's happening here is we're attempting to bring in a true participatory role of the community in the selection process of the developer. And if you want to go ahead and advance to the next slide, that'd be great, Heather.
Okay, trying to. Sorry. My computer's being a little funny. There we go. Okay.
And so, these two questions are there was a series of meetings that we've been to, both the Community Engagement Steering Committee as well as past foundation meetings. And out of that, obviously, came not just the interest of the community, but how well organized the community interest is. And with that, that's a tool in the tool chest that we can use. And so in terms of this first question here, which is a vast summary of many different questions, but the bottom line is how can the community shape the RFP and future phases? And you can do that. And what we're attempting to do is to specifically figure out how that participatory role is. And we're making some pretty good advancements on that. But essentially, the draft has not started yet. When the plan is at this time is when the drafting of the RFP begins. And that's the process by which identifying how to actually present the expectations and the requirements of the county to the developer community upon which they'll be responding. During that drafting period, there will be a period in which there's a rough draft and then it gets finalized. And in between the rough draft and the final approach to finalizing that draft, we're going to hopefully be allowed to have some sort of engagement with the developer community. At that point, it would be fantastic to have members through a sub-panel process of the foundation representing community engagement that would be available for the developer community to both communicate with about the community engagement piece of the RFP. They're going to be very, very interested in that. And then yet also that we're going to be able to take that and glean from that the insights to finalize the draft. That's not something that's typically done. And so that's the first role of participation would be in finalizing the draft. The second area is with respect to the actual RFP itself. There will be major, very significant sections of the RFP process that the developers will address in their individual responses. With respect to the community engagement piece, that in and of itself, that community input, that community outreach component, that will be, in fact, a major section of the RFP. And this is where, and you might want to maybe go ahead and forward to the next slide. This is where we're starting to have some real discussions about how to formulate that. How do we bring in the foundation into that process where the developer proposals are being reviewed? And we think we're making progress on that through the use of a sub-panel, and a sub-panel that would come in and actually be able to be the, if you will, the community review of the developers' proposals, those sections specific to community outreach. And then with that, a recommendation is then made to the evaluation panel that scores and selects the developer. Once the developer is selected, there is and this is more of a typical situation. Once the developer is selected, the developer is selected based on a series of promises, if you will. That's just a gross oversimplification, but that's essentially it. They make promises, they're evaluated on their capacity to deliver on those promises, and they are selected. And I think we've all received notices at one point or another, come to a public hearing, and we're going to hear all about this development that's going to occur. Well, that's water under the bridge. That's after the developer has already been selected. In this instance, what we're talking about is the community engagement piece is already helped draft the finalization of the RFP and has also been a participant in the recommendation that led to the scoring and selection of that developer. Those are unique and different. Now we get to that community piece after the developer has been selected. And while that's a typical element where you get the notice to come to the public hearing and talk to the developer about the project that they have been selected to build, at that point, though, you now have been, the community itself has been part of that whole selection process, the creation upon which they were selected. And so the oversight in terms of, let's say, enforcing the promises made, there's a much greater understanding of that. And so that's what we're hoping to do with this process at this point. And like I said, it's we've been engaged very early by the foundation. This is not something that we're halfway down the road and completed on. The foundation reached out to us very, very early, and so we're all part of this process as it's being born right now, if you will. And that's the update for now.
Thank you so much, Doug. So I see active chat going on. Thank you, Kelly, for being quickly on the chat. Is there anything you'd like to speak to out loud, Kelly?
Sure, I'll just circle back to Natalie's question. Thanks for your question, Natalie. unfortunately, it's not easy to get that kind of information. You'd think that the county would track this information building by building, but we don't. We will reach out to the Department of Health Services and see if they have an estimate for what they're spending on General Hospital, and we will provide that if we can get that information. And then I wanted to address, yeah.
Oh, could I ask a follow-up on that topic? If it is a significant amount of money, is it possible that that's being used currently as for upkeep, or maybe even that would be anticipated as a liability in the form of like deferred maintenance?
Yeah.
Is it possible that could maybe signal an additional funding source? Because I saw in the feasibility study, county general funds is not included as a possible funding source. So basically, if the county is currently spending money and would otherwise be spending money on this property, could the county keep sort of pitching in to maybe make more affordable housing or lower rents feasible?
Yeah, sure. Great. A good question, Greg. So there are about 1,000 people working in the building, the majority of which are Department of Health Services employees. And of course, the Wellness Center is there, and there's a Navy training facility. So the Department of Health Services would need to vacate the building along with the other functions, either permanently or temporarily, in order to allow renovations to occur. And I suspect they may need to take that budget with them, but it's certainly something that will be looked at as part of the RFP phase and as part of negotiations with developers.
Okay, thank you.
Sure. I can turn to Monica's question. I'll just read it aloud. Good morning, everyone. When I looked at the feasibility study, it seems that all the affordable housing will be in the hospital and the other acreage will be more part of commercial uses. Is this correct? The hospital redevelopment is the hardest part of the project. I'll start with your last sentence. Yes, you are correct. The hospital redevelopment is the hardest part of the project because it's a building, as you know, that was designed in the late 20s. So it's coming up on 100 years of its design, and then was completed in 1933. And it's quite large as well. So that is the challenging part of the project. It will be up to the development team to decide how best to allocate a variety of uses, including affordable housing across General Hospital and the campus. The study specifically does not recommend or indicate what that allocation should be, because as Doug Cohen has described very well a few times, we really want to give the developer team maximum flexibility to come up with a solution that works financially as well as meets the community's priorities and uses and the county requirements, and then factors in all of those technical considerations. Any other questions?
Yeah, any other questions people want to pose? I think we have a few people that have had to leave us, not surprisingly. Vivian has some questions about workforce housing for people employed at LAC USC.
Oh, great. I'm sorry, I didn't catch up.
It just showed up, and it's
but
that's the summary of the question: is workforce housing. For the people in the middle, like basically, they don't qualify for housing subsidy, but then they need affordable housing for their income.
Sure. Again, I think that's all on the table for the development community to consider. The workforce housing, I know, is something the supervisor's office is very interested in. We've also heard from the community that they are very interested in housing for the very lowest income neighbors. So that is all to be sorted out as the development community ponders how best to deliver the project financially and technically to the county.
Thank you. And Kelly, I think we're going to say final question. Is the county considering a bond or other financing tool driven by county to help with the funding the funding requirements of the project?
Not at this moment. And a bond, as you know, it's just like a mortgage on a property. You pay it back over time. So there would still need to be a dedicated funding source for that bond. If there are low-income housing tax credits included in the financing package, there is a requirement for locally issued bonds that the LACDA, the Los Angeles County Community Development Authority, would need to issue as a kind of a local match. But right now, until we see what comes in through the RFP process, there are no specific discussions in the county about floating a bond.
Okay, I said final question, but I was a bit of a liar because there would be one last question, but this will be our last question. And it's from Pam. She's kind of asking about what are the revenue generating considerations from the campus, and is there any? I'm going to summarize your question or comment, Pam. And is there any sense of a revenue sharing model that might include some county receiving some of those funds for future uses or revenue generating purposes on the campus?
So again, that would all be part of the negotiation with the selected developer. And it could be something that the selected developer indicates in their proposal to the county. So again, I think, again, when we say leave it open and flexible, that means kind of everything's on the table for discussion and consideration. And the most creative development team, again, we're looking for best in class level developers to tackle a potential project of this scope and scale with two very different components. Renovation of a very large historic building is not something that all contractors have experience with and all developers have experience with. And the new construction on West Campus is, again, a different kind of project. So maximum flexibility allows for all sorts of creative ideas, and this could be one of them. Thanks for the question.
Great, really interesting dialogue, great questions. Doug, do you have any final comments about anything you've heard discussed? Because as Kelly says, much of this will then live in the RFP and then in those developer proposals and ultimately negotiations.
Yeah, and thank you for letting me have the time here. So the RFP, really what we're doing is we're assembling all the expectations of the county, of which obviously the community engagement piece is a significant portion of that. And then it's a matter of how do we best do several things? How do we best take those expectations and present them clearly to the developer community so that they clearly understand that where they want to emphasize their capacities for both not only construction, but also for project financing. And the reason those two elements are very important for us to understand on our side is we're taking those expectations, we're presenting a platform for the developer community to see the expectations and then see where it is that they can sharpen their pencils, because this is in a competitive environment. And what we want to make sure of is that the more certainty we provide the developer community as to what our expectations are, the less second guessing they have to do, and the more they can sharpen their pencils in that competitive environment. So I know that's a lot of words being mashed together, but that's essentially what our role is in creating this RFP. The second element is the strategy in which we get in front of best in class competition. So it's not just best in class, it's best in class competition. We want, if the world is the eyes onto this deal, so be it. But we have to identify how we present that platform, to the greatest number of the developers that can compete openly with each other.
Thank you so much, Doug. I know Guadalupe, you wanted to chime in with a final comment, and then I think we will be concluding today's meeting. I know you'll be seeing Doug and Kelly back again at some future meetings as we wrap up this portion of the incredible effort that's come to date and the incredible effort that still lies ahead. But Guadalupe, please wrap us up.
And I just want to thank, all our membership here for all the really great questions. But as Doug and Kelly have indicated, we're at a point that it's too soon. We know that definitely there's community engagement that's going to continue. We're very committed to that. And Doug provided, some of the areas where definitely there's a lot of room for that. And in regards to the financing, I know that, we're trying to also, attract state funding to help with, furthering the affordable, housing units on the site. And so that's a strategy that we're doing. And I think overall we'll know more once, there's responses, to the RFP, what that looks like, right, on some of the questions that were asked. And in addition, just other funding that will come about. But we are actively looking for ways how we can bring resources to this effort that is a very key priority for all of us.
Thank you so much, Guadalupe. With that, we thank everyone for your participation here today, your active, engaged participation, your constant commitment to our county process, and your support for the Health Innovation Community Partnership opportunity to really share, to come into dialogue with community residents, community leaders, and agency officials. And just it's the goodwill of this body that really kind of sustains us through this work. And we'll be delighted to be welcoming you back to our next meeting, which will be on Friday, June 3rd. I think not many, but a few of the presentations here today will have a deeper dive on. I imagine Doug will have some deeper updates for us on the RFP process by that time, as well as we're going to be focusing in on the restorative care village and taking a little bit of a bigger lens on the opportunities there, although you got a lot of great highlights today. All right, with that, I'll say thank you all, one and all, and we'll see you in a month.